Welcome to High Truths on Drugs and Addiction, where national experts bring you facts and answer your questions. I'm your host, Dr. Roneet, an emergency and addiction doctor who has served at the White House and still practices on the front lines. Right here on High Truths, you will learn from experts from around the globe and around all aspects of drugs and addiction. Friends, fentanyl is plaguing America. There is no safe drug supply unless it comes from a legal pharmacy. If you are around anyone who may be using drugs, you should carry naloxone, the opioid reversal agent. Carrying naloxone for drugs is like carrying an EpiPen for allergies. Come visit me on hightruths.com to learn more about the show, submit a question, or download a free prescription for naloxone. Today's episode is sponsored by ISAAC, the International Academy on the Science and Impact of Cannabis. Visit their website at isaac1.org, that's IASIC1.org, to follow the science on marijuana. Hello again, High Truth listeners. It is 2023, a brand new year and another circle around the sun. I'm your host, Dr. Roneet. 2023 brings new hopes and new wishes, as well as Season 3 of High Truths on Drugs and Addiction. Each time you tear a leaf off a calendar, you present a new place for new ideas. That's a quote from Charles Kettering, an American inventor and engineer. This episode is my monologue and introduction for a new leaf and new ideas for this High Truth season. I will share with you why I do this High Truth podcast, reflect on issues of drugs, share some proud and disappointing moments of 2022, and end with hopes for 2023. Why High Truths? People ask me, why do I host a podcast? I'm not a show host, nor a journalist, nor a politician. I'm just a doctor. I make a living by working shifts in the emergency department. But I also want to make our world a better place. And if I cannot do that, at least I want to make healthcare better. I witness such heartbreak in emergency medicine, especially with people who suffer from drugs, mental health, and homelessness. It's hard to just watch and not want to take action. But it seems helpless. What can one person do? And that's where this High Truths podcast comes in. When I share High Truths with you, I educate myself through your questions and conversations with international experts. By sharing these conversations with you, I know you will be educated, inspired, and empowered. You can take that knowledge to your community, to your profession, and personal life. This way, with each episode, bit by bit, together, we can make the world a little bit better. That's how, with each episode, I hope to bring you a little bit more high truths. About drugs. How much high truths can there be on the issue of drugs and addiction? This is episode 106. You would think that after speaking to over 100 guests, I would have covered everything there is to talk about drugs. And yet, I find more interesting experts and angles that are important to consider. I have immense gratitude to the guests and experts who opened my mind, inspired me, and educated me. And having these conversations is one of my favorite things besides playing with my granddaughter. I'm so excited and thankful that these new experts and new perspectives would join me this season. Drugs and addiction are complex. There are individual drugs, tobacco, alcohol, marijuana, opioids, stimulants, psychedelics, prescriptions, and more. And there's also to consider the various intervention aspects for drugs, such as primary prevention in youth, pre-addiction intervention, treatment of substance use disorder, and harm reduction, as well as supporting people in recovery, which is a vital component in the drug use continuum. In talking about drugs, we cannot ignore the aspect of supply. The supply chain is handled by law enforcement, politics, and diplomacy. Supply matters. We also rarely consider the economic aspects of drugs. Sometimes I wonder how our taxpayer dollars spent on welfare goes directly to pay for individuals' drugs. There are real economic benefits for drug dealers and cartels. Drugs are good business, but shouldn't we be changing that model? Also to consider is society at large, with violence, drug driving, and damage to the environment. Another angle brings us social considerations, social issues to the individual, family, spirituality, social norms, and what we see on TV and social media. So as you see, drugs are not so simple. And that's how I filled 106 High Truth episodes with another full season yet to come. At High Truths, I cover all these aspects and try to see the issue of drugs through a wide lens. And through that, I can learn and strive to make things a little better. I want to share some proud accomplishments for High Truths and for me in 2022. First, I'm so proud of the all-star cast of experts and perspectives on High Truths. Who is wise? One who learns from all people. That's a saying from Pirke Avot, Ethics of the Father. This podcast continues to give me wisdom through conversations and education from my experts and from you, our listeners, who send me questions. But High Truths is more than a podcast. I aim to bring action and solutions out of our conversations. I use the knowledge I gain from my guests and from you and integrate them into lectures as I give as a physician. I gave about 24 presentations to audiences in the United States, United Kingdom, and Israel in the past year, sharing High Truths. I take the tips I learn through this podcast to be a better doctor for my patients in the emergency department. Education and clinical practice are important, but much greater reach occurs when levers are pressed that change how we do business. And I'm so proud of writing my first piece of legislation that was signed into law by California Governor Gavin Newsom about fentanyl testing. The bill was authored by Republican Senator Melissa Melendez, and in a very heavily Democratic state with serious partisan politics, the bill gained multiple Democratic co-authors and cruised through the legislative process in record time. It is a testament that both sides of the aisle want solutions to the fentanyl crisis. With Tyler's Law, starting in January 2023, all hospitals in California are required to include fentanyl whenever a drug screen is ordered. California is the first and only state in the country to make this requirement, and hopefully other states will follow. You can learn more about how three mothers who didn't know each other came together to make this law happen on High Truth episodes number 98. While the fentanyl legislation was a win, the Cannabis Right to Know Act was a flop. The Cannabis Right to Know Act would have required labeling on cannabis products similar to warning labels on tobacco and alcohol. We have warning labels before watching flashing lights on movies. There is science behind how labels work and how best to use them. The Cannabis Right to Know Act was backed by a large coalition that supported such warning labels. The coalition included community leaders, prevention specialists, the American College of Emergency Physicians, the gynecologists, the pediatricians. We had a powerful, heart-wrenching testimony for parents whose children died because of cannabis. And you can hear their voice on episode number 83. Yet, the power of the cannabis lobby and their money successfully killed the bill. Sad. But I won't give up. There are other avenues to take to inform, to protect the public, especially for babies and children. On a community level in San Diego, I chair the San Diego Credo Task Force, the community response to drug overdoses. Each month, leaders from public health, law enforcement, harm reduction, and prevention meet in order to discuss what is happening boots on the ground and break through silos to work together. Through this collaboration, we are connecting harm reduction to overdose locations. We are learning about gaps on how to protect children at households where overdoses occur. And slowly, I hope to implement the concept of what I call contact tracing for overdoses. For each overdose, there are family and friends who are at risk. Knowing this and making an intervention can save lives. And now I'd like to share with you my hopes for 2023. My hopes for 2023 for High Truths is threefold. My first hope is for High Truths is to promote healthy parity to drugs and addiction as we do for infectious diseases and other chronic illnesses. You've heard me say, I'm jealous of drugs. In my next episode of High Truths with Dr. Nora Wolkoff, you will hear me tell her that I'm jealous, but she says she's not. Rather, she's inspired by the possibilities when she sees what has been done with COVID. I hope we bring parity in the concept and solutions to drugs as we've had for COVID, monkeypox, and other diseases. Dr. Wolkoff is inspired by COVID, but I'm still jealous. When I see hotel rooms for COVID and Shigella diarrhea with no place for people to go who want to stop using drugs, it gives me a little jab. And I get another jab when I read regular updates in the media of stories of flu and RSV when days go by without a peep on the issue of fentanyl and drugs. My second hope is number 2, to bring together and understand the separate roles we each have in dealing with drugs, from law enforcement, primary prevention, treatment, and harm reduction. Each aspect is important, and each one deals with a different cohort of the population. Each also has a different prevention message. Understanding the different roles we have can dispense with some of the hostilities between different advocacy groups. The 3 main population cohorts are, number 1, people who have never used drugs, number 2, people who occasionally misuse drugs, and number 3, people who have a substance use disorder. For the cohort of the population that does not use drugs, children, the message is, good job. This is the social norm, and please continue to protect your brain until it is done growing at the age of 25 or more. For people who occasionally misuse drugs and do not have an addiction, the message is that fentanyl is in all the drug supply. One use could be your last. It could be deadly, and therefore please don't use alone and have naloxone on hand by someone who is not using, because you can't give naloxone to yourself. Finally, for people who have a substance use disorder, we should promote treatment with compassion and no stigma of this chronic brain disorder. And if there is resistance to treatment, there is a harm reduction approach. It's inappropriate to push harm reduction on kids who don't use drugs, just like it's inappropriate to tell people with a substance use disorder that they should simply stop using. And my third high truth hope is number 3, exploring the fascinating interventions on the horizon from fentanyl vaccine to rescue drugs for stimulants. There is promising research and innovations in this field. Drug overdoses are preventable, addiction is treatable, and there is hope in our future. And with this, I wish you all a happy and healthy 2023 filled with much high truths. Thank you for listening to High Truths on Drugs and Addiction, where national experts bring you facts and answer your questions. Today's episode is sponsored by ISAC, the International Academy on the Science and Impact of Cannabis. Visit their website at isac1.org, that's IASIC1.org, to follow the science on marijuana. Our producer is Dave Rivas from Davey Boy Productions. I'm your host, Dr. Roneet Lev. We hope we brought your day a little bit more high truths.